your tonsil, it's just a different part of the body. So the tonsils sit at the back of your throat, your epiglottitis sits a little bit below your larynx here. So it's just a lower portion of the airway.
It says in the description that, she's flaring her nostrils and has a hoarse voice when talking.
Mm-hmm. That's a sign and symptom of epiglottitis. Those
Not
two,
tonsillitis.
both of them.
So what are you saying? It could be B or C?
So the answer is C. So you have to look at the signs and symptoms in the timeline. So she's been sick for the last few days. So epiglottitis usually has an onset of 2 to 3 days. That's why it's C. Tonsillitis is usually onset of 24 hours.
How are we supposed to know that?
What question?
I think it could be B or C.
Right, the questions are A, B, and C, then it narrows down to B and C, so you have to go back to the question, look at the context clue. So as you get deeper into the subject matter, you'll know the difference between the two subject matters and able to make the best decision. So every time you look at a question, it's always gonna be the two right answers. You have to figure out which answer reflects the question.
It's also the fact that it's a 6-year-old girl, so I shouldn't be asking a 6-year-old girl what's going to be asking a parent. Parents monitor kids, so that's who will give me the information for that. You always ask how long, what's going on. It's a child. I can't just walk up and talk to a child.
I'm just going by the description. It says, her nostrils are flaring and she has a hoarse voice when talking.
Mm-hmm. So
And B and C, they both transport her to the hospital. Okay.
yeah, so what that comes down to is just knowing all the signs and symptoms of the medical conditions. When you take the national, they're gonna present to you two very similar questions. There's gonna be maybe 1 or 2 words off of the correct answer. And that's what this is coming down to, knowing the onset of the specific medical condition. Tonsillitis is usually a 24-hour onset, whereas epiglottitis is typically 2 to 3 days. That's the reason that is C versus B. I know it can be tricky, that's what they try to do. They try to make sure you know what you know, all right? Do we need 34?
Yes.
All right, how many lobes of the lungs are there? The answer to this is gonna be C, which is 5. So your right side of your lung, you have 3 lobes, and then the left side you have 2. Right is upper, middle, lower. Left side is upper and lower. Sometimes they're called superior, middle, and inferior. Superior being top, inferior being below. Okay?
You mean 3?
3, yeah. 3
You
lobes
said
on the
5.
right side. So 5 total. 3 right side, 2 left side.
You know, it's crazy. I remember that it's 5 because my ex-fiance, when she was doing her stuff in nursing, she used to do it on me.
Oh.
So, that's how I knew that.
Oh, that was a mouthful what you said there. We'll get into that later.
Oh, I'm sorry. she used to like practice on me for like her nursing classes and stuff.
Now it's your turn.
Yeah, look
That
at
was
you
my
doing great
first
things. Okay?
Let's keep her around.
So kind of a trick question with the wording, right? Lobes, multiple of the lungs. We know we have 2 lungs, left and right, but what parts of them, okay? Lobes, break it down. Airway. Any questions with that? No? Alright, 35. The airway is divided into upper and lower portions by what anatomical location? D. Alright.
How do you pronounce that?
So the laryngopharynx, alright, that's the lowest part of your respiratory tract there, or your airway, okay? You guys just need to know primarily that the airway is divided into upper and lower portions, okay? I know for a fact that's on your national. Sometimes they ask you like, list the following that are in your upper airway, so you need to know like 36, the most common cause of pediatric cardiac arrest is dyspnea. Alright, does anybody know what that word means?
Breathing.
Difficulty breathing. Anytime you see disc in front of anything, difficulty doing that. Dysuria, difficulty urinating. Dyspnea, difficulty breathing. Alright. So respiratory distress is the number one cause of pediatric cardiac arrest.
You said definition is difficulty breathing?
37. You respond to the scene of an unresponsive 26-year-old male at a skateboarding park. Upon assessment, you hear snoring respirations and know it is cyanosis to his extremities. You should
C.
C. You're gonna insert an oral pharyngeal airway adjunct. Okay? Snoring respirations mean what? What's in the way?
Soft airway obstruction.
Yes, the airway obstruction, it's the tongue, most likely, alright, snoring. You go unconscious, you get that muscle relaxation, your tongue flips to the back of your throat, and congratulations, you can't breathe like you used to, okay? Any questions? You doing alright, man? Appreciate you sticking with it. You gonna pay off. Any questions for you two over there? Okay? 38. You are dispatched to the residence of a 45-year-old male diagnosed with pharyngeal cancer. Does anybody know what that is? Pharyngeal
It's in.
throat cancer. Look at you guys knowing. Yeah, good job. His wife tells you that since his stoma placement, does anybody know what a stoma is? Yeah, it's like the little circular cutout in the throat that we sometimes come across here as EMTs. So since this patient's stoma placement, he has been unable to expel phlegm and cough. Upon arrival, your partner obtains a set of vitals as follows: a pulse of 88, an SpO2 of 92%, and a respiratory rate of 26. You should first suction the airway with a soft tip suction catheter. Alright, I know we mentioned earlier that when we suction adult patients, we use the rigid or the Yankauer. If you ever come across a patient that has a stoma or a trach, they're used interchangeably, you need to suction them with a soft tip, okay? Don't use a rigid. It'll dislodge a lot of stuff back there, okay?
So what's the correct answer?
So it's
D.
D, suction the airway with a soft tip suction catheter. 39, 40, anyone?
You got it wrong.
39, which of the following are signs or symptoms of imminent respiratory failure? Select all that apply.
A and C.
A and C, correct. So head bobbing. If your patient is up and talking to you, and then they start to bob their head, that means that they're circling the drain. If they can't keep their head up, they can't talk to you, then that's a problem. Yes, select all that apply. They'll get you. It's alright. You just gotta read the question, man. You'll get it. Alright, so that and then absent breath sounds. So if you're in respiratory failure and I don't hear breath sounds, that means you are not breathing. Okay, that's why it's also C. Okay? 40.
What's 39?
A.
It's B, it's A and C, it's false.
Never mind, my fault.
39.
I was on 41.
So for 40 is false. Ventilation and respiration cannot be used interchangeably. Those are two different definitions, okay? Ventilation is the active movement of air throughout the respiratory tract, and respiration is the gas exchange that takes place at the lower portion of the lower portion of the airway at the alveoli, okay? 41.
A.
Okay, so 41, upon inhalation, what is inhalation? Inhaling. So upon breathing in, the diaphragm contracts to enlarge the chest cavity.
So
Okay.
it's not D.
It's
It's not D?
So the lungs enlarge, correct?
So the diaphragm does the opposite of what seems as common sense, okay? When it expands, it pushes that air out. When it contracts, it brings the air in. Think of a negative pressure. Yeah. Crazy, you got a whole lot going on in this whole section of your body, okay? So when the diaphragm contracts, it draws in negative pressure. Upon inhalation, think about it. When you take a deep breath, what does the air do? Go in or out?
And
Okay, alright? Any questions with that? It's alright, man, we're here to learn. 42?
Yeah.
Alright, 42 is all of the above. 43?
A.
A.
It was A?
Yeah, A. Okay. Number one cause of COPD. Put the cigarettes down, man.
No.
Breathing. The cigarettes. Okay. 44. Yeah. Patient who recently went scuba diving. You have that change in pressures. Okay. So if I were to say an 18-year-old male that recently got off of a flight, would he be a candidate for a spontaneous pneumothorax?
Good.
He could, absolutely.
I don't know what that word means.
It's a collapse lung. Oh.
So think about it. In this space here, we just talked about negative pressure, okay, negative positive pressure. If someone goes scuba diving, you know that they have to descend at a certain rate because otherwise they will collapse their entire body because of, right. So same way, sometimes they go down too fast, they come back up. This is why they get a spontaneous pneumothorax when they come back to the surface, okay? Same thing with people who like to skydive. What is it when they do with the cord on their feet?
Bungee jumping?
Yeah, that too. So,
Oh, so bungee jumping's bad for you.
it's a lot of ways to die, man. You're gonna figure that out.
Did you say a lot of ways to die?
Yeah.
What is that space called again?
The pleural space.
I heard when you jump off
Out of the ground.
bridge into water, that can be one too.
So that would be more of a like a hemothorax, that crush, or yeah, that sudden crushing or that blunt force
It's
trauma
the
to your
impact.
chest. Yeah.
I experienced that before.
But what did he thinking?
Belly flop.
That's
Yeah,
good.
Jumping off that when I really thought, yeah, I experienced that.
Just gotta be careful, guys.
Uh,
45. Yeah. So
I mean, yeah.
it's false.
Yeah.
it's false. Epiglottitis is an upper airway obstruction.
upper,
Yeah, it's an upper airway, not lower.
Okay.
So you gotta watch out for those questions. There'll be double negatives on there. We try to word these like the national so you get in the habit of reading the question thoroughly and trying to break down what it's asking. Okay. I'll put a double negative in there, something that crosses itself out. Just read it again, read the question, read the answer, read it again. Okay? 46. Cystic fibrosis, a genetic disorder primarily affecting the lungs. Okay? That was in your chapter, correct? That didn't pop up in your chapter yet? It's just, I'm talking to you.
Oh, me?
Yeah,
Oh, I ain't get that far.
you okay? That's alright. So, give yourself some grace there. 47.
C.
Suction the airway. So aspiration, it's another word for vomit or fluid. So know your vocab words. This is an unconscious person. That means they cannot maintain their own airway. They have fluid in there. We don't want them to breathe that in, get pneumonia. So we're gonna suction that airway. 48.
See.
C. Insert a nasal pharyngeal airway adjunct.
Got
Okay.
one of those to show them.
I pulled one out. This is a nasal pharyngeal airway adjunct. So nasal pharyngeal, nose, oral pharyngeal, mouth. Oral. No, that's the only one that's open. Okay?
That goes up to another one.
Yeah.
Yeah. So next week we'll show you guys guys have
Oh,
size
good, yeah.
patients for them. Cause everyone's nose isn't the same size, or their nasal cavity isn't as wide or long. Obviously, pediatric patients, you're gonna wanna use a smaller one, adult patients, you're gonna wanna use a bigger one. Alright, 49. B, use the head tilt chin lift maneuver to open the airway. 50. A, fluid in the upper airway. Okay, that's what gurgling is. Think about it. Alright guys, that's all I got for you.